Hello everyone, my name is Corissa Giseburt. Today I am excited to present my Doctor of Nursing Practice project titled Implementing a Clinical Decision Support System to Decrease Workplace Violence Against Nurses and Improve Nursing Burnout. This work represents a culmination of my academic journey at Maryville University and aims to address critical issues within the nursing profession. I would like to acknowledge my committee members. My chair for this project is Dr. Heather Deering, who provided invaluable mentorship and guidance. My second reader is Dr. Rochelle Davis-Citron, who provided essential insights during the evaluation process. Additionally, I had the support of a community member, Tricia England. Thank you all for your guidance and support. The primary aim of this project was to investigate the impact of a clinical decision support system on workplace violence, WPV, and nursing burnout. Workplace violence is a significant concern in healthcare, particularly for nurses who often face aggressive behaviors from patients and visitors. This violence can manifest in various forms, including verbal threats, physical assaults, and psychological harassment. The consequences of workplace violence extend beyond immediate safety concerns, leading to increased stress, job dissatisfaction, and ultimately burnout among nursing staff. Given the rising incidence of workplace violence, exacerbated by the COVID-19 pandemic, this project seeks to develop effective interventions to enhance nurse safety and well-being, thereby improving both nurse and patient outcomes. To contextualize my project, I conducted a thorough literature review, which highlights several key findings. Workplace violence is increasingly prevalent in healthcare settings, with studies indicating that nearly 50% of nurses experience some form of violence during their careers. Hendrickson, 2022. The impact of workplace violence is profound, contributing to high rates of burnout, anxiety, and depression among nurses. Tsumoto et al. 2022. Evidence-based interventions such as standardized de-escalation training and risk assessment tools have been shown to significantly reduce workplace violence incidents. McGuire et al. 2019. The dynamic appraisal of situational aggression is one such tool that helps predict aggressive behaviors, enabling nurses to prepare and respond effectively. These findings underscore the urgent need for targeted interventions to address workplace violence in nursing. This project was guided by two key frameworks, the Rossworm and Larrabee model and the Plan, Do, Study, Act model. Rossworm and Larrabee. This model emphasizes a systematic approach to implementing evidence-based practice through 5 key steps: assessing the practice problem, gathering evidence, translating the evidence into practice, implementing the change, and evaluating the outcomes. By following this structured approach, I was able to clearly define the problem of workplace violence, gather relevant evidence, and design an intervention aimed at improving nurse confidence and reducing burnout. The Plan, Do, Study, Act model. The PDSA model provides a cyclical framework for continuous improvement. It consists of 4 stages. 1. Plan. Identify a goal or change to be tested. 2. Do. Implement the change on a small scale. 3. Study. Analyze the results to see if the change is effective. 4. Act. If successful, implement the change on a broader scale. If not, refine the approach. This model was instrumental in guiding the implementation of the clinical decision support system, allowing for iterative testing and refinement of the intervention based on feedback and outcomes. Together, these frameworks provide a comprehensive foundation for the project, ensuring the approach was both systematic and adaptive to the needs of the nursing staff. I employed a quality improvement initiative utilizing a pre and post intervention design which is particularly effective for evaluating the impact of specific interventions. This design allows for direct comparisons of data collected before and after the intervention, providing insights into its effectiveness. The tools used in this project include the Confidence in Coping with Patient Aggression and the Professional Quality of Life Scale, both of which are validated instruments that assess nurses' confidence levels and professional quality of life. This combination of tools was chosen to comprehensively evaluate the intervention's impact on both confidence and workplace safety. The sample for this study consisted of registered nurses working in the cardiovascular thoracic unit at a Midwestern healthcare facility. A total of 36 nurses participated, representing a diverse demographic with approximately 80% identifying as Caucasian and 20% from other ethnic backgrounds. All participants were over 18 years of age. This demographic diversity is crucial as it allows for a more comprehensive understanding of how different backgrounds may influence experiences with workplace violence and the effectiveness of the intervention. The quasi-experimental study involved a sample of 36 registered nurses, predominantly Caucasian. The analysis utilized the Wilcoxon-signed rank test to evaluate the impact of the dynamic appraisal of situational aggression and the aggression prevention protocol on workplace violence. Effect sizes indicated varying degrees of impact on compassion, burnout, and secondary traumatic stress. The study highlights the importance of time for participants to fully grasp intervention concepts, suggesting further evaluation may enhance understanding and efficacy in reducing workplace violence. The analysis conducted using the Wilcoxon-signed rank test revealed significant findings regarding the implementation of the dynamic appraisal of situational aggression and the aggression prevention protocol in reducing workplace violence and enhancing nurses' well-being. Key results include a statistically significant improvement in compassion satisfaction as measured by the ProQual scale, with a p-value of less than 0.014, leading to the rejection of the null hypothesis. This indicates that the interventions positively impacted nurses' satisfaction in their roles. However, no significant differences were found in the scores for confidence in coping with patient aggression, with a p-value less than 0.086, burnout less than 0.387, or secondary traumatic stress with a p of less than 0.831, suggesting that while compassion satisfaction improved, other areas did not show measurable change. While the DASA and the APP interventions demonstrated a positive effect on compassion satisfaction, further efforts are necessary to address the challenges related to workload and data integrity to enhance the effectiveness of future implementations. However, this project was not without its limitations. One significant challenge was the limited time frame for the intervention, which may have constrained participants' ability to fully integrate the new tools into their daily routines. Additionally, there was potential for underreporting of workplace violence incidents, which could skew the results and limit the understanding of the true impact of the intervention. The sample size, while adequate for this study, may also limit the generalizability of the findings to other healthcare settings, indicating a need for further research with larger and more diverse samples. The results also highlighted several unintended consequences, such as increased workload, potentially leading to higher stress levels among nurses, and issues with data collection due to incomplete reporting and staff turnover. These factors may have affected the overall validity of this study. The results of this project underscore the critical importance of effective interventions in mitigating workplace violence and enhancing nurse well-being. Here are some key points for the discussion. 1. Positive correlation between intervention and outcomes. The significant increase in nurses' compassion satisfaction indicates that the clinical decision support system was partially effective in equipping nurses with the necessary skills to manage aggressive behaviors. This aligns with existing literature that emphasizes the value of training and preparedness in reducing workplace violence. 2. Impact on workplace environments. Implementing structured risk assessment tools like the DASA can create a safer work environment. A safer workplace benefits nurses and enhances patient care quality, as nurses who feel safe are more likely to engage positively with patients. 3. Burnout trends. Although the reduction in burnout levels was not identified, even modest improvements in compassion satisfaction can contribute to lower burnout rates. This reinforces the need for ongoing support and training to sustain these initiatives. 4. Importance of continuous training. This project highlights the necessity for continuous education and reinforcement of de-escalation strategies. As workplace violence remains a persistent issue in healthcare settings, regular training sessions can help maintain high levels of confidence among nursing staff. 5. Broader implications for healthcare policy. The findings from this project can inform healthcare policies aimed at improving workplace violence and safety for nurses. By demonstrating the efficacy of evidence-based interventions, this work supports the call for healthcare organizations to adopt standardized protocols for managing aggression and violence. 6. Future research directions. Further studies need to assess the long-term effects of the DASA and APP tools in various healthcare settings. Expanding the sample size and including diverse clinical environments can enhance the generalizability of the findings. Additionally, exploring the integration of these tools with other interventions such as mental health support programs could provide a more comprehensive approach to reducing workplace violence. The implications of this study for nursing practice are significant and multifaceted. Here are several key points to consider. 1. Enhanced nurse safety. The findings demonstrate that implementing a clinical decision support system, particularly the DASA and APP tools, can enhance nurse safety in the workplace. Griffith et al., 2020. By equipping nurses with the ability to practice, predict, and manage aggressive behaviors, organizations can foster a safer environment, which is crucial given the rising rates of workplace violence. 2. Improved patient outcomes. A safer environment for nurses directly correlates with improved patient care. Alenzi, 2024. When nurses feel secure and confident, they are more likely to provide high-quality care, engage positively with patients, and maintain higher levels of empathy and compassion. 3. Reduction in burnout. While the study showed only a likelihood of reduced burnout, organizations can help mitigate burnout, which is a leading factor in nurse turnover. Taksamoto, 2022. 4. Ongoing training and support. The study highlights the need for continuous training and support for nursing staff. Regular workshops and refreshers on de-escalation techniques and the use of risk assessment tools can help maintain high levels of preparedness among nurses. McGuire et al., 2019. 5. Policy advocacy. The results advocate for healthcare policies that prioritize nurse safety and workplace violence prevention. Hendrickson, 2022. 6. Interprofessional collaboration. The implementation of these tools fosters an environment of collaboration among healthcare professionals. Griffith et al., 2020. Nurses, physicians, and support staff can work together more effectively to manage aggressive patients. The implications of this study extend beyond individual nursing practice. By adopting evidence-based interventions and prioritizing nurse safety, healthcare organizations can create a more supportive environment that benefits both staff and patients. The findings serve as a call to action for ongoing commitment to improving workplace conditions within the nursing profession. In summary, the findings from this project highlight the significant impact of implementing a clinical decision support system, specifically the dynamic appraisal of situational aggression and the aggression prevention protocol on workplace violence and nursing burnout. Additionally, there was a statistically significant improvement in compassion satisfaction, which underscores the positive emotional and professional outcomes resulting from this intervention. The implications for nursing practice are profound. By equipping nurses with the tools to predict and manage aggression, healthcare organizations can significantly enhance nurse safety, which directly correlates with improved patient care. A safer environment fosters better patient-nurse interactions, ultimately leading to a higher quality of care and increased patient satisfaction. Moreover, the study emphasizes the necessity for ongoing training and support. Regular educational sessions on de-escalation techniques and the effective use of risk assessment tools can help sustain the positive outcomes observed in this project. This commitment to continuous education not only empowers nursing staff, but also reinforces a culture of safety within healthcare settings. Additionally, the findings advocate for policy changes that prioritize nurse safety and address workplace violence. By demonstrating the effectiveness of evidence-based interventions, this project can inform an organizational and governmental policies aimed at establishing comprehensive workplace violence prevention programs. In conclusion, this project serves as a vital step toward improving workplace conditions for nurses. The integration of evidence-based tools and strategies not only enhances nurse well-being, but also elevates the standard of care provided to patients. As we move forward, it is essential to continue researching and implementing such interventions to create safer, more supportive healthcare environments. The knowledge and skills gained through the Doctor of Nursing Practice program have deeply informed my approach to these challenges, reinforcing my commitment to advocating for the safety and well-being of nursing professionals. Finally, I have included a list of references which supports the research and findings presented in this project. Thank you for your attention.